Hi everybody. So I am on Facebook Live today to talk to you all about anxiety. I do want to sorry about that. Went to another screen. I do want to apologize beforehand if I start coughing in the middle of this talk. I'm battling a wicked cold, so that is why we did have to reschedule it to today. But anyway, so let's talk about anxiety. It's such an important thing to discuss because anxiety doesn't just cause issues with when a person is experiencing it. Anxiety puts stress on a person's system that can develop into other issues down the road. So when you have this constant stress on your system, it can lead to things like depression, fertility issues, a weaker immune system, heart disease, etc. Pretty much anything you can think of. So it's better for us to break this cycle of anxiety and stress before it has long-term effects on the body. So it's especially important for us to be talking about anxiety because the rates of anxiety continue to increase. And we see kids in the office at Van Every as young as 8 years old these days on high doses of anxiety medication, which is really frightening to see someone so young already on a medication that most likely they're going to be told they have to be on for the rest of their life. So why exactly are the rates rising? Why is anxiety increasing? There are a lot of theories out there. There are experts that believe a big part of it has to do with television, 24/7 news broadcasting, the increase in social media, constant connectivity to the internet. So basically, don't watch the news all the time and try and stay off social media. That's one way to at least kind of avoid the negative things that are coming from that feeling of constant judgment or constant worry of what's going on with the news. There are also experts that say that a lot of it has to do with America's way of being. So it's really big in America to, strive to do that 40-hour plus work week. And when you do that, I'm not saying that that's necessarily the cause of stress, but when people work this much, they are then decreasing the amount of time to eat healthy and exercise and be involved in social activity, a lot of things that help bring down anxiety and stress. So that's another theory that people have out there. There's also medical experts that believe that a big rise in anxiety has to do with how all the toxins in the environment are affecting our endocrine system. So a lot of the toxins that are in our foods, specifically processed foods, and the things that are, that we put on our body, could be cosmetics or your shampoo or your conditioner. Those things also can disrupt your endocrine system, and that's a big part of how your body handles stress and anxiety. So there are a lot of things out there that having a big role to play in why there's an increase in anxiety. If you're concerned that your child is struggling from anxiety, it's really important to understand that the symptoms of anxiety in a child often don't look the same as the symptoms of anxiety in an adult. So oftentimes a child doesn't even understand that what they're experiencing is the feeling of anxiety. And I'll use myself as an example because when I was about 10 years old, I started to become more aware of the fact that I would have these days where I kind of felt like I was in a fog. And it was hard to explain to people. I just kind of felt foggy, like I wasn't there, and my mind would be busy thinking about things that could go wrong. So I used to have these crazy thoughts about what would I do if I got cancer, or what if there was a burglar that came into our house in the middle of the night, or what if there's a fire. And when I was young, I didn't really understand that feeling and wasn't able to verbalize it to people. And it wasn't until I got much older that I realized that kind of fogginess and thoughts of worry was actually anxiety. I thought that mainly anxiety had to do with just experiencing an anxiety attack. And in reality, anxiety attacks are not very common. There's 14% of the population is what they estimate are people who have anxiety disorders, but only about 3% of the population have actual anxiety attacks. So it's important to know that if you are concerned about your child having anxiety, it's going to be presented a little bit different. And on top of what I just stated about my experience with anxiety, I'm going to go over some of the other common symptoms that kids could be experiencing. And don't get me wrong, this isn't just about kids and anxiety, but we do tend to focus there in our office because we want to try and cut this habit of anxiety earlier so that they don't end up becoming adults with anxiety. So what are some signs of anxiety in kids? When it comes to sleep, the big ones are a child experiencing night terrors, sleepwalking, not being able to sleep unless they're sleeping with a parent, or a child that wakes up many times in the night and it's really hard to get them back to sleep. So oftentimes this has to do with a big issue in the fight-flight being very ramped up and their rest relaxation not being able to work the way that it's supposed to. So those are our different parts of our nervous system. Fight or flight is your sympathetic nervous system. Rest, digest, or rest relaxation is your parasympathetic nervous system. So oftentimes these kids are stuck in that fight or flight and they're not able to turn their brain off and calm down the way that they're supposed to at night. And this is one of the beautiful benefits of chiropractic and how adjustments are able to help with that, because when we adjust, we are actually stimulating that parasympathetic nervous system, allowing the body to relax and get improved sleep. And in fact, I'd say that improved sleep and even deeper sleep, so we get a lot of people who experience very vivid dreams, are one of the most common very first benefits that people experience. So, we do get a lot of people coming for other things, especially pain, and they'll notice their sleep changing before anything else changes. Another common anxiety for young children is unstable emotions. So basically having reactions that are a little bit overboard. So like things that seem so minor, they'll have a temper tantrum over it. There's also experiences with kids who are unmotivated to do anything. So it's a little bit on the flip side of having overboard emotions. There are the kids who they aren't motivated to do anything. And then there are those that seem like smart kids, but emotionally they seem a little bit younger. So they are smart, but very immature. And that's one of the main results of when you grow up in fight or flight mode. You'll become, your brain's still developing that intelligence, but that emotional intelligence is not improving the way that it's supposed to. Another example of symptoms would be inflexible OCD tendencies. This is one that a lot of parents tend to pick up on pretty quickly if their child has OCD, doesn't like things to change, get very aggravated or defensive when they do have to do something outside their norm. That's when a lot of parents tend to, that's like the first thing that gets their brain going that maybe my kid has anxiety. Another thing that can happen is kids have type A stress at way too young of an age. So these are the kids that are putting a lot of pressure on themselves. So they freak out if they don't get all A's, or they freak out if they're not doing as well in sports that they're supposed to. And don't get me wrong, it's great for a kid to want to push themselves and be successful, but to have a little bit of an overboard reaction to not being the best at something is usually a sign of anxiety. So changes of routine really throws these types of kids out of whack. GI issues are also a telltale sign of anxiety. This goes for adults as well. Oftentimes, anxiety presents itself in the gut. I think many people have experienced this. So anytime that you're nervous about something, you're anxious, it could be a sport, a test, anything like that, people tend to notice that their gut tends to feel kind of icky. They'll get nauseous. So this has a lot to do with that vagus nerve. It's a nerve that originates up here at the brainstem, and the gut-brain connection. And this is another place where chiropractic really comes into play, because when we do adjust, we're stimulating that vagus nerve very often. Lastly, low self-esteem and confidence is a very common sign of anxiety. So kids that don't like to get involved or have a little bit of, they're lacking social awareness. Kids should be able to be kids. When they're in constant worry of judgment, that's not normal, and it's a problem that needs to be fixed. So being aware of that and not just thinking that your kid is just shy and that's just them. It's not how kids are supposed to be. It's usually because they're having some type of constant worry go on in their head. Now for adults, they can have a lot of the symptoms that I just went over for kids, but the common signs of anxiety are a little bit different. In adults, they tend to be more physical. So that would include heart palpitations, tightness in the chest, difficulty concentrating, sweating, chronic pain, headaches. Chronic pain is a pretty big one for adult anxiety. oftentimes our emotions tend to create pain in the body. So people have chronic pain and can't really figure out why it's there. Oftentimes stress or anxiety has a big part to do with it. So what do we do about anxiety? I'm going to start with telling people to get their thyroid checked. And I'm not talking the standard thyroid test that if you go into your doctor, they'll test like 1 or 2 things and say you're good. I'm talking the full test. So that means T3, T4, TSH. And the reason I'm saying this has to do with when I was talking about endocrine dysfunction from all the toxins. So thyroid issues often present with anxiety, depression, and brain fog. And there have been countless stories, and I've done a lot of research, and especially with this one doctor who specializes in thyroid disorders. She can't say enough about how many people that she sees when they fix their thyroid, their anxiety, depression goes away. So it was actually the thyroid issues that was causing the anxiety and depression. So if you have other symptoms that seem like they could also be related to thyroid dysfunction, your first route when trying to figure out what's causing your anxiety should be to get your thyroid checked first and make sure that's not a big part of it. Cleaning up the diet is absolutely huge. I know no one likes me to tell them to change what they're eating. I don't like to tell myself to change what I'm eating, but that's going to be a big part of anxiety because of the whole gut-brain connection. So processed foods are a big no-no. And what I tell people during our wellness talks at the office is when it comes to nutrition, ask yourself, how many processes did this food go through after it left the ground? So if you start asking yourself that over and over again, every time you go to buy food, eventually you're going to start to feel guilty buying this processed food that you know has gone through so many different chemical processes in order for it to be this nice, tasty bag of Oreos that you're eating. And Oreos are my weakness, so I'm not judging you if you still eat processed food, but try to decrease it because it is going to affect your anxiety in a big way. Eating a lot of sugar is also not great. Primarily, yes, sugar is going to cause inflammation in the body, which is no good, but sugar can also lead to blood sugar spikes, which are then followed by a big blood sugar low, and that usually affects mood. It can cause people to go into a bit of a depression or a stress. I know that personally for me, food's a big part of whether or not my anxiety is going to be ramped up. It's also important to be getting all of the important nutrients that can have a big effect on anxiety, and those would be vitamin B, magnesium, and fish oil. And there are some people out there who have stated that essential oils help them big time with their anxiety. Every person is different in terms of what essential oil helps them best. Some it's just lavender because it helps calm the mind. Some people like to use the things that smell like the woods or more natural smells can help calm their nervous system as well. So do a little research yourself on essential oils and see what works best for you. There are also common adaptogens and amino acids that many people use to help with anxiety and stress. The common adaptogens are ashwagandha, reiki mushroom, and rhodiola. And then the popular amino acids are GABA, taurine, and L-theanine. I personally take ashwagandha, not for anxiety, but it does help with that, along with many other benefits. And then 5-HTP is something that I took in the past, and that's a synthesized amino acid. So there are many things out there that can help you with mood regulation. I highly recommend checking into them. But of course, I don't want anybody going to the store and buying any of these supplements and going to town on them without first talking to your chiropractor or with any other medical professional to find out if these are things that are safe and good for you to use. And excuse me, sorry. Last thing, it's really important to be active and get some sort of regular physical activity. And there's actual science behind why exercise makes us feel better, why it improves our mood. And that's because when you are exercising, we speed up that process of getting rid of anxiety hormones and neurotransmitters. So those are cortisol, epinephrine, and norepinephrine. So I'm not telling you to work out just because you got to work out to be healthy. If you are struggling with anxiety, being active is going to decrease those anxiety hormones in your body. So find something that you enjoy doing. Like for instance, I don't love to work out, but I love to play sports. So I have found a way to stay active, a way to increase my physical activity while still having fun. So yours could be going on long walks in the woods or a walk with your dog. If you like to dance, go do jazzercise or something like that. So find a way to increase your activity and your anxiety will decrease. Also make sure to get a lot of rest. So the recommended amount of rest for adults is 7 to 9 hours. It's a little more for kids. The reason why this is so important in the realm of anxiety is that when you are getting enough sleep, you are balancing your hormones. So if your sleep schedule is all whacked out, you're getting 5 hours, then you're getting 4, then you're getting 7, your hormones go a little bit crazy, and that's going to increase your chance of anxiety. Also very important is to find ways to be present. I think this is a big thing that is talked about a lot now, how to stay present and stay in the present moment, because the old adage of depression is living in the past, anxiety is living in the future. So you want to stay present, and that can help decrease your anxiety substantially. When I struggled from anxiety when I was younger and found out that's what it was, my biggest advice that I was given was, when I'm struggling with anxiety, focus on the little details of things around me. Like if I'm on a walk, like looking at a leaf or looking at a tree and just kind of focusing on the little ridges in it and things like that. It helps bring your mind back to the present, so it's no longer having those anxious thoughts about the future. Some people, walking outside is their best way to decrease their anxiety and stay present. People also love to do yoga and meditation for that as well. When it comes to meditation, I can't tell you how many people I tell that they should start meditating, that they say, oh, I can't meditate, I can't do that, I can't turn my brain off. And the thing that I tell them is, meditation, you got to think of it like a sport. You're not going to be great at meditating when you first start meditating, but when you keep up with it all the time, you will become much better at it, and trust me, you will notice the benefits. And also, there are plenty of different types of meditation out there, so you can find the one that fits best for you. So I highly recommend that. The more present you are, the easier it's going to be to get yourself out of anxiety. Lastly, get adjusted. So, like I stated earlier, getting adjusted is going to help stimulate that rest or digest part of the body. And, excuse me. So it's going to help stimulate that rest or digest part of the body. So a lot of times with anxiety, the issue is that we're stuck in fight or flight mode. And that's going to be, especially if part of it is that you're not getting enough sleep, chiropractic's going to help with that immensely. And then, of course, the fact that the gut is so connected to our anxiety, the gut-brain connection, getting adjusted is also going to help with that as well. So we need all of our organs to function properly in order to get all the toxins out of our body that could be playing a role in anxiety. And when you get adjusted and you're allowing all those nerves to communicate with your organs the way that they're supposed to, they're able to work to do that detoxification process much more efficiently. So that's another way that chiropractic comes into role. And something that I actually want to go back and mention when it comes to things to help with anxiety, seeing somebody to talk to about anxiety is also a huge thing. It's somehow become a taboo thing to say that you go to a therapist or a psychiatrist. Everyone who knows me knows I see a therapist because I tell everyone how fantastic she is. And I tell people, even if they're not struggling from something in particular, you should still see a therapist. So don't let it be a taboo thing. Go and see someone. It can help immensely talking to somebody. So I just didn't want to forget to mention that as well as ways to help with anxiety. What I want to end with, excuse me. I want to end with a story about one of our patients. Because we have seen so many patients have improvements with anxiety at our office, but this one, she kind of stuck close to me a little bit because she was so young, going through so much, and to see her life turn around has been phenomenal. So this patient, she's very young, and she was having night terrors. Her mom brought her in because she was having night terrors every night, sometimes more than one. Always had to sleep with her parents. and she was having temper tantrums every single day before school. And even when she came in, just energy level was low, wasn't too excited to be there. So after about 6 or 7 adjustments, her mom told us that the night terrors had decreased significantly. So this is a girl who is having 1 or more night terrors a night. After only 6 or 7 adjustments, we calmed that nervous system down enough where she was only maybe having 2 or 3 a week, even less. So that was really awesome to hear. And then before her 12th visit, which I know it was before then because we re-scanned her and did a re-exam at the 12th visit, she came in to the office and told us, well, she told me I adjusted her that day, and she was so excited to let me know that she slept in her own bed that week for the first time. So that was huge. She was so excited. This was a brand new girl, super lively, full of energy. Her night terrors were essentially gone at this point, and here she is now being able to sleep in her own bed. And her mom let us know a little while after that after the first day of school started, she had a temper tantrum before the first day of school, but then nothing after that. So this girl was struggling from anxiety that was affecting her life significantly, and I can only imagine what would have happened if she hadn't come to see us. She would have eventually put on drugs for anxiety, probably some for sleep, and she would have been stuck on those for a long time, and her immune system would have just continued to weaken, and this little girl would have grown up to be a sick adult. So I know chiropractic can do wonders for kids struggling with anxiety. It can do a lot for adults as well. There are a lot more facets involved with adults struggling with anxiety, though. But I just wanted you all to hear that story because I want you to know that chiropractic can make a big difference with anxiety and really help these kids grow up into healthier adults. So if you suspect that your child is struggling from anxiety, we would love to chat and how we can help. And we also love to help adults with anxiety too. So please feel free to give us a call at Van Every Family Chiropractic if you have any questions or any concerns about you or a family member having anxiety. So you can also message us on Facebook as well. So I hope you all got a lot of good information out of this and that you have a wonderful day. Bye. Oh, come on.